you have the folders, you even found a deal on the sneakers your kids want to buy in back to school. But there's one more thing you can't forget, your student's checkup. Kelly Swoop has insight from a local primary care doctor.
Joining us now to help us send our kids back to school, the peak of health, is Dr. Lisa Carey, pediatrics and internal medicine at GBMC. Thank you so much for coming in.
Thank you for having me.
So, doctor, tell us why this is the best time of year for people to schedule those back-to-school checkups for their kids.
So we really like to see children of all ages once a year. When they're little, it's a lot about their growth, their development, are they meeting all their milestones? But then when they are a little bit older and they're school age, we do all that, but then we also like to talk to them about, how school went last year, if they need any help with us for the next year, how sports are, family life, social life. And then as they're a little bit older, when they're into their teenage years, they also get the chance to talk to us alone and really start to establish their own relationship with us, with their own doctor.
So what kind of things are you looking at in terms of these back-to-school appointments, in terms of physical issues?
So, we call them a well-child check, and like I said, we do a lot of just growth and development. Depending on how old they are, we check their vision, their hearing, and then when they're a little bit older, like I said, we like to talk to them, how did school go for you last year? I like to know what their grades are, what their plans are for the summer, socially, how are they doing with people at school, and things like that.
So I have an 11th grader, we're going into 7th grade. Is there anything that a parent can do to prepare them for those appointments?
I guess I would say sometimes they don't always know that they can be totally open with us. I always like to tell them that they should feel free to talk to us about any concerns or anything like that. But we do a lot of what we call anticipatory guidance too as pediatricians, which basically talks to you and the child about how things that might be coming up in the next year, whether it be school or socially, because things change quickly when you're that age. So we do a lot of that stuff too.
And I imagine the appointments and checkups are different for like maybe children with allergies or asthma or, like you said, are in sports.
Right, exactly. And then the sports physicals are a little bit different. So I always like to know when a child comes in, a lot of times we just do their annual checkup, but for a sports physical, we do a little bit more. I always like to ask them if they played sports last year, how it went, make sure that there's nothing worrisome if they got a lot of injuries, or making sure that they are feeling okay when they're exercising, able to keep up with other kids on their team. Since usually, one or both of the parents are present, it's also a good time to go over their family history, just to make sure there's nothing that could run in the family that would make me a little bit, more thorough in talking to them before I clear them. And then we always do a complete physical exam, but we like to focus more on the musculoskeletal system too.
Lastly, is there any reason why you would need to have these wellness checks maybe more than once a year?
No, typically just for a healthy child, the American Academy of Pediatrics likes to see them once a year, but for kids that do have things like you mentioned, like asthma, we typically do see them a few times a year just to check in on them.
All right, Dr. Lisa Carey, thanks for joining us. I know you were very busy at this time of year.
Thank you.
All right, thanks for coming in.